generalized tonic/clonic seizure, the patient is rigid and his back is arched. This represents the blank phase of the seizure. During a generalized tonic/clonic seizure, the patient is rigid and his back is arched. This represents the blank phase of the seizure. Hypertonic. An idiopathic seizure is one in which the cause is not known. In contrast to a benign neoplasm, a malignant neoplasm can metastasize to other parts of the body. A neoplasm is most accurately defined as a new growth. Although the patient is likely experiencing a TIA, you should treat her as though she is experiencing a stroke. Dehydration. In contrast to syncope, a seizure can occur when the patient is in any position. A 19-year-old man presents with a decreased level of consciousness. According to his girlfriend, he has no known medical problems and takes no medications. Initial treatment for this patient involves ensuring airway patency and adequate breathing. Open his airway and begin assisting his ventilations, establish an IV or IO line, and administer 5 to 10 mg of diazepam. For any patient with an increase in intracranial pressure, the paramedic must maintain an adequate blood pressure. Pre-hospital treatment for a patient with a suspected stroke may include all of the following: EXCEPT, up to 325 mg of aspirin, rule out hypoglycemia by assessing his blood sugar, but suspect a right-sided ischemic stroke. The involuntary, rhythmic movement of the eyes is called nystagmus. Which of the following would have the most negative effect on the outcome of a patient with an intracranial hemorrhage? Hypotension. As intracranial pressure rises, cerebral herniation may occur. According to the Los Angeles Pre-Hospital Stroke Screen, the possibility of a stroke is increased if the blood glucose is between 60 and 400 mg per deciliter. What is the cerebral perfusion pressure of a patient with a mean arterial pressure of 80 mm Hg and an intracranial pressure of 5 mm Hg? 75 mm Hg. Administering oxygen as tolerated, establishing an IV line, padding the rails of the ambulance cot, and transporting without lights and siren. Oxygen as tolerated, starting an IV line, and administering ondansetron, and transporting without lights or siren. All of the following are examples of acute cerebrovascular emergencies: EXCEPT. Accumulation of atherosclerotic plaque. A high level of oxygen to the brain of a patient with a hemorrhagic stroke, and increased intracranial pressure, causes vasoconstriction and can impair brain perfusion. Which of the following would most likely cause a sustained increase in intracranial pressure? Intracranial tumor. when neurons are deprived of oxygen and glucose. They convert to anaerobic metabolism. Absence. Which of the following causes of altered mental status is not an acute process? Uremia. An intracranial neoplasm. When did you first notice your wife's symptoms? A 29-year-old man, who was recently prescribed an antipsychotic medication, presents with an acute onset of bizarre contortions of the face. Treatment should include diphenhydramine, 25 mg. Positive pressure ventilatory support. Provide supportive care, and safely transport her to the hospital. A loss of balance and equilibrium suggests injury to the cerebellum. A patient experiences severe, shock-like or stabbing pain to one side of the face. This is consistent with trigeminal neuralgia. A patient who is unable to use a common object is said to be apraxic. A patient with a Glasgow Coma Scale score of 8 or less may require definitive airway control. A patient with a unilateral eyelid droop when smiling may be experiencing Bell palsy. A patient with suspected meningitis involuntarily flexes her knees when her head is flexed toward her chest. This is called Brzezinski sign. A person's level of consciousness is regulated by the reticular activating system. A staggering gait is most suggestive of damage to the cerebellum. A synapse is a slight gap between nerve cells. All of the following cranial nerves are responsible for airway control, except the abducens. Among other functions, the medulla oblongata controls blood pressure and heart rate. An adult who opens her eyes in response to verbal stimuli, is disoriented, and pushes her hand away when you palpate a painful area has a Glasgow Coma Scale score of 12. Rule out hypoglycemia by assessing his blood sugar, but suspect a right-sided ischemic stroke. Assist his ventilations, and assess his oxygen saturation. Because the facial nerve does not decussate, a stroke to the right cerebral hemisphere would most likely cause left-sided weakness and right-sided facial droop. Common causes of trismus in an unresponsive patient include all of the following, except opiate toxicity. Common signs and symptoms of a cerebral abscess include high-grade fever, persistent localized headache, confusion, and focal impairment. During a generalized tonic/clonic seizure, the patient is rigid and his back is arched. This represents the blank phase of the seizure. Hypertonic. Emotions such as rage and anger are generated in the limbic system. Hyperventilating. A patient who has increased intracranial pressure will constrict the cerebral vasculature and decrease cerebral perfusion. In contrast to a benign neoplasm, a malignant neoplasm can metastasize to other parts of the body. In contrast to patients in shock, patients with increased intracranial pressure (MOST) often experience a wide impulse pressure. Increased intracranial pressure hydrocephalus occurs when the movement of CSF decreases, but the production of CSF does not. Patients with trismus often require sedation or chemical paralysis to facilitate airway control. Spasmodic torticollis is characterized by neck muscle contraction, which twists the head to one side. The most common sign of an infectious disease is the presence of a fever. What portion of the brainstem regulates respiratory rate and depth? Pons. When performing the arm drift test on a patient with a suspected stroke, a positive finding is characterized by one arm drifting downward and turning toward the body when the patient's eyes are closed. Which of the following conditions is a neural tube defect in which part of the nervous system remains outside the body? Spina bifida. Which of the following cranial nerves are assessed when you ask a patient to follow your finger as you move it in an H shape? Trochlear, oculomotor, abducens. Which of the following cranial nerves regulates movement of the head and shoulders? Accessory. Which of the following is an example of receptive aphasia? You ask a patient who the president is and he or she says, January. Assist ventilations, apply the cardiac monitor, start an IV line with normal saline, administer 12.5 grams of 50% dextrose, and reassess his level of consciousness. Administering oxygen as tolerated, establishing an IV line, padding the rails of the ambulance cot, and transporting without lights and siren. Blank is a term used to describe changes in a person's ability to perform coordinated motions, such as walking. Ataxia. The peripheral nervous system is responsible for sending messages to and receiving messages from the brain. A person's LOC is regulated by RES reticular activating system. A 35-year-old athletic man experiences a stroke that completely incapacitates him, while a 55-year-old man who does not exercise and is sedentary gets a clean bill of health from his physician. The 35-year-old man most likely had a/N Genetic predisposition. The most immediate and significant complication associated with a hemorrhagic stroke is increased intracranial pressure. Which of the following would most likely cause you a sustained increase in ICP? Blood, swelling, pus, or a tumor within the cranial vault. Management for a patient with a neurologic emergency begins by taking deliberate actions to ensure personal safety. Decerebrate posturing is a more severe finding than decorticate posturing, as it indicates damage in or near the brain stem. When communicating with a geriatric man who has dementia, you should determine how much change has occurred in his level of consciousness. An acutely frustrated, angry or aggressive patient should be assumed to be low glucose and O2 or taking narcotics. A patient with a GCS score of 8 or less. Intubate. A patient with a unilateral eyelid droop when smiling can indicate Bell's palsy or a stroke. Absence. Myelin functions by allowing the neuron to send its signal consistently along the axon without losing its electricity. Degenerative conditions of the nervous system result when a normal structure is altered over time. Chemicals that relay electrically conducted signals from one neuron to another are called neurotransmitters. A patient who is experiencing agnosia may call a knife a fork when he or she is asked to name the object. Which of the following signs is most commonly observed in patients with a severe headache or increased intracranial pressure? Nausea and vomiting. A rhythmic contraction and relaxation of muscle groups that is commonly observed during a seizure is called blank activity. Clonic. A stroke to the right cerebral hemisphere would most likely cause left-sided weakness and right-sided facial droop. As blood glucose levels fall below blank mg/dl, level of consciousness begins to decrease. 60. Which of the following disease processes is characterized by an abnormal gait in which the patient places his or her feet very close together and shuffles while walking? Parkinson's disease.